Now, usually, when patients visit us, they always have certain problems like bad breath, that's halitosis. Sometimes they say, ma'am, we have spontaneous bleeding from our gums or bleeding on brushing. We become very like conscious when we go and talk to someone in a close proximity because of this bad breath. Now, in that case, I'm here to solve your issues, and now I'll be guiding you how to get rid of these two problems. Now, the magic here lies in the procedure, which one should go every 6 monthly. It's not for these people only, it's for keeping your teeth and gums healthy. Now, let you want to know that what's that procedure all about? Now, that procedure is scaling. Now, hey viewers, welcome again on my channel, Dr. Shafali, School Wali Dr. Sahiba. And today I'm going to talk about the different reasons why one should go for a scaling. Now, generally, for a good dental health, one should go for scaling at least twice a year, that is 6 monthly. Now, do you know why? This will not only maintain your gum health but also will make your teeth strong. Because naturally, the amount of calcium and magnesium salts are present in the saliva and they get deposited along your teeth and thereby creating calculus and plaque on your teeth. Now, this plaque and calculus contains the microorganisms, the numerous ones, which damages your gingiva and thereby making your gums loose. Now, what you should do? You should get the scaling done every 6 months, and also you should change your brush twice a year. Now, what is exactly the scaling procedure all about? Now, in this, there are two methods. Now, in one, there is manual scaling. Now, manual scaling is basically used for those patients whose teeth are extremely mobile, like it's more than grade 2 mobility. Now, regularly we use the ultrasonic scaler. Now, in ultrasonic scaler, there are ultrasonic vibrations and along with the water jet that acts as a coolant. Now, when we do the scaling, in general, the plaque and calculus, whichever is deposited over your teeth, that gets cleaned from the gingival margins and above your teeth, and thereby making your teeth absolutely clean, shining, like mine. Now, what you should do? Now, basically, you should visit a dentist who is certified. When you go for a scaling, initially, if you have like lot of calculus deposited around your teeth, you may feel slight movements in your teeth. You may find it a bit loose. But when once calculus is removed and then you do gentle massaging for approximately 21 days to a month, gradually your gingiva again gets attached to your teeth and thereby making the gums firm and healthy. Now, that is the exact position which is healthier. Earlier, which was like seeming that it is not moving, but exactly that was the cause of further damage to the bone and further gum tissues. Now, after doing the scaling, now the condition has been resolved and now you are going to make your gingiva absolutely healthy. Now, further bone loss, your gingival tissue loss is stopped at the moment. Within like 24 hours, it's like microbial counts reduces by millions. Now, that's the case. Second thing, people say after doing scaling, your enamel get destroyed. Now, actually, scaling is a double-edged sword. If done correctly, it is a boon. But if not done correctly, it will be a curse. Now, let me tell you why. Now, basically, whenever we do scaling, we put our tip of the scaler at the deepest part and thereby, due to vibrations, that complete calculus gets removed. Now, in case if you like keep on curbing the enamel part of your teeth to remove the calculus in the opposite direction, then in that case, yes, of course, some amount of enamel may be damaged. So, it depends on the skills of the dentist to whom you are taking the treatment. So, obviously, you should go for such a dentist who is really good in the field. Please opt wisely. Now, third thing. Okay, post you will be asking me, ma'am, why initial sensitivity and later on it gets resolved. So, initially the sensitivity is due to the fact that when the calculus is removed, your enamel and the root junction that's exposed, there the dentinal tubules get exposed and thereby the patient feels sensitivity. But gradually, when the gum tissue heals, it gets attached to the teeth firmly. So, in that case, the dentinal tubules which were exposed earlier gets blocked. Now, when they gets covered, then in that case, sensitivity gradually gets resolved. Now, another thing people ask that, okay, our teeth became mobile. This mobility is again reduced. Like what it was initially, it gradually reduces. Now, you'll say, ma'am, is it like extremely mobile tooth gets firm again? No, that could not be possible. That is absolutely not possible. You'll be asking me why? Because once the bone is lost, that could be corrected only by periodontal surgery. You need a perio surgery for that. I need to put the bone grafts in your bone. Then only the tooth can become firm again like a new one. But normally it's not done. Very rare, serious patients are gone through the surgery. So in regular cases, the amount of mobility gets reduced with time. Like if it was extreme, it comes to less extreme. And if it is absolutely healthy, slightest mobility is there, in that case, it gets resolved in like 2 weeks around. And for sensitivity issues, now I can tell you certain methods how to resolve that sensitivity issue. One thing, most of the dentists, what they usually give an anti-sensitivity paste and along with that a mouthwash, which is really helpful to reduce the sensitivity. Now you have to use that complete things for approximately 1 to 1.5 months, and gradually this sensitivity issue is completely resolved. Like you need not worry at all. Second thing, now you'll be saying again, what else needs to be done? You need to use a gum paint so that your gums may stick back to their place.